I'd like to invite Dr. John sir for his talk.
So thanks, Dr. Prithvi, for that insight into the various frugal innovations that he has done. And now I'll be talking about a few of the apps which ophthalmologists will find useful, and something about 3D printing and so on. So without further ado, I'll go ahead. So there are a lot of apps. So I'm just going to go quickly through this. If anybody wants to take a photograph, feel free to quickly take a photograph. So I started programming when I was in school, and that's how I got involved in all this. So I'm just skipping through all of these and just going to talk about the ophthal apps which you will be finding useful in the OP. So starting from history examination onwards, there are several apps we can use. So for example, if you have a language barrier, there are apps which I made during fellowship. So that is I Know Tamil and I Know Bangla apps made during when my studies in Arvind and Shankar Nethralaya respectively, for conversing with patients who are not fluent in English and you want to talk to them in Tamil or Bangla respectively. Then there are so many apps for systemic examination which will not be useful particularly for us. Visual acuity, there are some apps which can be used on the phone. So you can use the Peak Acuity app as a standalone app on your phone, or you can use the iChart Pro, in which you can control a tab with a phone and do visual acuity. So essentially that is converting a tab and phone into a visual acuity chart. Then stereo acuity can be tested by using this random dot stereogram testing app. So that is the NTU RDS screening test. For this you will need the red blue glasses. So ocular examination, you can do a lot of measurements by using these techniques. So here the measurements can be done with a scale on a chart on a face, and the measurements can be calculated by using Image Meter Pro app. And head position, eye position, there are apps like Eye Turn and Eye Tilt for measuring the head tilt positions, and the 9-gaze app for documenting the 9 gazes. Then a lot of anterior segment photography, Dr. Prithvi has covered it, and you can do all these photography much better than a slit lamp, commercial slit lamp camera, if you use the lenses and lighting correctly. And toric IOL marking, there are a few apps. Toric IOL axis marker, iToric and Crystal Toric are very useful apps. Fundus photo, there are a lot of devices. One is the Jaundice Funduscope, which is a foldable fundus camera. I'm not going to details of these. And this is a list of several apps which can be used. So this is not basically a list. I'll tell you the apps which are going to be very useful. So this app is having a lot of tests and calculators. So you look through this, you will have visual acuity, contrast sensitivity, color vision, pediatric optotypes, fixation targets, duochrome test, all of these in the same app. This is called the Eye Handbook. And you even have an optokinetic nystagmus drum. So you can have the Okain drum, and you can increase the speed of the chart moving, and you can look for optokinetic nystagmus. And I'll show you. Okay, these are on the right here. If you see, this is a device which uses a smartphone to do power testing of the spectacles, and that is from iNetra. Okay, so that is not an app per se, but that's a smartphone based lensometer. The Eye Handbook app is something which all of you can use for free. So that is something which I would suggest if you can download and start using, in which the calculator and the testing parts are what you will be using most of the time. So that is what we have covered. And there are several IOL calculator apps. If you are using a toric IOL, use that particular company's IOL calculator apps. And there are all the visual acuity corrections, conversion between Snellen to Logmar. All this is available in the Eye Handbook, which I talked about earlier. And so these are all things which are there in the eye handbook. Due to shortage of time, I'll go quickly through this. There is an app to do the Farnsworth-Munsell 15 hue test. So that is in the colorblind test app. There is a one of the options is doing a Farnsworth-Munsell 15 hue test. And Park's 3-step test is now integrated into the eye handbook as well. Stereo tab is again you use red blue glasses and you can do stereopsis testing. Stereo acuity cardboard is no longer available. Visual Fields Easy was the initial free version of the MRF fields, so that is now a commercial device. Same Dr. George Kong had released the Visual Fields Easy app on the iPad. So if you want to do a very generic visual fields without sensitivity, maybe for neurological cases, you can do that. OCT browser, if you have the OCT files and you want to look through all the slices, this is something which you can use. And medication reminder apps for patients, there are a lot of apps, and My Eye Drops is one particular good app. IOL vision simulator for showing patients what vision would be with different types of IOLs. And this is not important. This is an eye grader app for postgraduates and also practicing ophthalmologists to have all the grading systems in ophthalmology. So you can go through this and then go for say bleb grading or diabetic retinopathy grading or disc damage likelihood scale. All these are in a common platform here. Language helper apps I already covered. These are useful for talking to patients when that is not your mother tongue. There are several apps for low vision patients that is there in this particular video as well as this particular Kerala Journal of Ophthalmology article. And so there are so many apps available. Maybe you can take a picture of this also. So many apps available. So eye handbook is probably what you will be using for most of the thing. iChart Pro if you want to have a remote control vision testing. Peak if you want to just do vision testing in an easy way. All the others are special use cases. 3D, I'll just talk about 3D photography because imaging is very important in ophthalmology, but not only that, stereo imaging is also very important in ophthalmology. So I had made a 3D atlas of ophthalmology, and I basically used an app called 3D Steroid to take photographs. So you can basically take two photograph left and right views and combine them in different ways to view in 3D. So for example, this will be a 3D image if viewed through a virtual reality headset, because the left eye and the right eye will get these separate images, and when you fuse them you will get stereopsis and see the image in 3D. So that is the 3D atlas of ophthalmology. So all these images are 3D. So this is a left and right side by side image for a virtual reality headset, whereas this is a red blue glasses anaglyph image. So if you get the red blue glasses, the 3D glasses, you can see the 3D in this image, and that is a very useful teaching tool also. You can get a lot of 3D anaglyph videos also, surgical videos also. So these are available on YouTube and iTube as well. So you can download that, you can use the red blue glasses and see the videos in proper 3D. And yeah, making own 3D content is a little difficult. If you have a 3D camera, you can do this. This is an iCam taken in 3 just because. Will not go into how to take 3D images, that is going to take more time. So now I'll talk about 3D printing. So 3D printing is a very useful technique for innovators as well as for teachers. So there are lots of 3D models available, and if you find the right model you can use that for teaching. If you look at this is a 3D model of dialer or ball tip dialer, I would say, and this is a BHEX ring, and this is an Aurella backwards drainage implant, and these models can be downloaded and placed in your PowerPoint presentation by using insert 3D model from this device. So you just download these from this particular account, Thingiverse account of mine, or you can also download it from the National Institute of Health 3D website, and you will get so many other 3D models also. So you search for 3D models, which are usually STL files or GLB files, can download them and start using them in your PowerPoint presentations. And these 3D models can also be 3D printed. So these are the 3D printed glaucoma drainage devices which I had used, and these were very useful for practicing surgical steps in the wet lab. So if you may not get access to the glaucoma drainage device or some of the other surgical devices, you can just 3D print these, and these do not cost very much. You can look up on Google and search for 3D printer near me. You might find some dental labs also which do 3D printing, or maybe an engineering friend, they might have their own 3D printers, because 3D printers nowadays cost only around 15,000 rupees for a basic model, and that can be used to 3D print all these things. So this is a modular keratome innovation which we had done, and these are all 3D printed models. This is a 3D printed model of an IOL, and this is a large size training model. So for teaching surgery, it might be very difficult to understand the concepts at a microscopic level. So this is a macroscopic 3D printed model in which this blue is an anterior first represents the anterior capsule stained with trypan blue. The nucleus is yellow here, and if the nucleus is out, you can see the posterior capsule is having an orange glow. So that is a useful tool for teaching steps of cataract surgery. And this is also Phaco Pro, which is 3D printed, and this is a translucent printed sleeve also. So all these things are 3D printed. And this is a 3D printed punctal plug, and this was designed actually by MBBS students when I was teaching in Ramchandra. So it is not very difficult to start learning how to do 3D designing also. So if you have ideas for a new device or instrument, you can actually start drawing on paper and then draw the 3D model and then start seeing if it will going to work, and then manufacture it. And the prototyping will be easier with this. This is a 3D printed glaucoma drainage device which can be used for designing new devices as well as for practicing in wet lab. This links to the video. And this is the foldable fundoscope. So I'll just quickly go through this. So this is how I designed it, and this is how the first 3D printed version looked like, and this is what a later version with embedded illumination and magnetic docking looks like. So this is now patented, and it will be this is in the process of getting it out. So thank you to everyone, and thank you, Dr. Prithvi, for having me in this IC.
Thank you, John. Thank you, John sir.